Hello everyone. The Mental Health Awareness Committee would like to thank you for watching this short presentation on anxiety, depression, and memory decline. Throughout this presentation, we will provide some background knowledge on these conditions and ways to help manage them. The purpose of the Mental Health Awareness Committee is to educate the community about mental and neurological disorders in an effort to reduce the stigma that is often associated with these conditions. If you have any questions or concerns regarding this presentation or would like to be directed to more resources, please do not hesitate to call, text, or email MHAC using the contact information listed on the screen. Thank you for your time, and we hope you enjoy this presentation.
Coping with anxiety and depression can be challenging, but the Mental Health Awareness Committee is here to help you manage your mental health. Some tips on helping yourself include becoming an expert, so learning more about the medication treatment options, learning about more what you can do in terms of helping yourself. That includes the medications and the non-pharmacological therapy, including exercise and things of that sort, knowing your triggers and stressors, partnering with your healthcare providers, getting healthy, avoiding drugs and alcohol, and finding support. Despite the fact that there are 4 different types of anxiety disorders, all anxiety disorders have one thing in common: that's persistent excessive fear or worry in situations that are not threatening. And individuals may experience one or more of the following. So they may experience emotional symptoms, which include feelings of apprehension or dread, feeling tense and jumpy, restlessness or irritability, anticipating the worst, and being watchful for signs of danger. They also include physical symptoms such as pounding or racing of the heart, shortness of breath, upset stomach, sweating, tremors, twitches, headaches, fatigue, insomnia, and frequent urination. Both genetics and stress contribute to the development of anxiety. Some families will have higher than average numbers of members experiencing anxieties, and studies do support that, the evidence that anxiety disorders run in families. Stressful, traumatic events such as abuse, death of a loved one, violence of prolonged illness are all often linked to the development of anxiety disorders. There are different treatment options available for one who is experiencing anxiety, and those include psychotherapy, including cognitive behavioral therapy, medications such as anti-anxiety medications, and complementary health approaches, including stress and relaxation techniques. Now, it is imperative that if you are concerned that you may be experiencing anxiety, that you should contact your primary care doctor. Usually, when we didn't have the COVID-19 pandemic, we would usually hold health fairs, and in these cases we would screen patients, where we would have a one-on-one. We would talk about what you're experiencing, we would ask you some questions, and then kind of assess your anxiety and denote you into the category or the level of anxiety, and then from there we would determine whether or not you should contact your primary care provider. But right now we are doing the best that we can, given the conditions that we are undergoing. So it is definitely important to look out for the signs and symptoms, and then from there contact your primary care provider, schedule an appointment, and it definitely doesn't hurt to discuss to see whether or not you fall under the category of being diagnosed with anxiety. Depression is generally characterized by low mood, a loss of interest in daily activities, as well as alternating patterns in sleep. It affects people of various ages, as well as genders, racial, ethnic, and socioeconomic groups. Other symptoms include changes in sleep and appetite, as well as lack of energy. Patients usually have a hard time concentrating, as well as a loss of interest. They have low self-esteem and feelings of hopelessness, as well as the potential ability to manifest as physical aches and pains. Potential causes of depression include trauma, including childhood trauma, as well as genetics, life circumstances such as money problems, where a person lives, and marital status, brain structure, other medical conditions such as ADHD, history of sleep troubles, long-lasting pain, anxiety, and things of that sort, as well as drug and alcohol abuse. The potential treatment options for depression, in a sense, coincide with some of the anxiety treatment options, such as the medications and the psychotherapy, and they also include exercise, alternative therapies, as well as mind, body, and spirit approaches. There are different medications, different non-pharmacological therapies that are more geared towards depression and more geared towards anxiety. It's definitely important that if you think that you're experiencing any sort of signs of depression or anxiety, definitely contact your primary care provider, schedule an appointment, and sit down and discuss the feelings that you're feeling and let them know your current state. And from there, you guys can figure out what you can do to help improve your mental health from there. Thank you for listening to this presentation, and I hope it was informative.
Memory decline and problems are often overlooked. Misplacing your keys and phone can be a normal thing. However, serious memory decline that inhibits and slows down one's cognitive function and ability to navigate through daily activities should be addressed. Oftentimes, forgetfulness comes with age due to changes in the brain. This can also lead to slower learning. These changes are considered minor forgetfulness and can be quite normal. However, serious memory decline may indicate underlying changes that should be addressed. While there are many reasons that can cause memory decline, patients diagnosed with Alzheimer's disease are thought to have a buildup of amyloid plaques that impair cognitive functions. If you are struggling with memory decline, contact your doctor for a memory assessment. There are many possible reasons for memory decline. Aging is one of the possible causes. The brain ages just like any other part of the body, and changes in the brain may result in memory decline. Another potential cause is dementia and Alzheimer's. Dementia is characterized by memory disorders, personality changes, and impaired reasoning to the point that it interferes with daily life. It can be caused by conditions such as Alzheimer's. Side effects of medications can also be a cause. Some medications can cause memory impairment. Consult with your doctor to see if this applies to any medications you are taking. Diseases that affect the brain may also lead to changes in memory. Treatment of these diseases may help reduce its effect on memory. Anxiety, stress, and depression are all conditions that make a person more forgetful. Other reasons and causes might be head injury, stroke, and sleep deprivation. Did you know that good nutrition and exercise is important for maintaining proper brain function? Deficiency in vitamin B1 and B12 may impair memory and lead to memory decline. Some foods that contain vitamin B1 are vegetables such as cauliflowers, potatoes, kale, and asparagus, and fruits and dairy such as oranges and eggs. You can also obtain vitamin B12 from chicken, beef, and fish, or even low-fat dairy such as milk, yogurt, and cheese. Developing interests and hobbies and staying involved with community activities such as bingos and arts and crafts can help both the mind and body stay healthy. Studies have also shown that heavy drinking can lead to memory decline. According to the Centers for Disease Control and Prevention, the CDC, for men, heavy drinking is typically defined as consuming 15 drinks or more per week, and for women, it is defined as consuming 8 drinks or more per week. If you or a loved one is struggling with heavy drinking, consult with a physician for more information. While there are no current standard treatments for memory decline, treatments may include counseling, medications, or both. For patients who are considering medications, depending on the severity of the patient's memory decline, the doctor may prescribe Aricept or Namenda. People who are concerned about memory decline should contact their doctor or talk to a pharmacist for more information.
Lastly, MHAC wanted to provide you with some resources that you can use to learn about mental disorders and ways you can help your own mental health. You can reach out to your doctor about your mental health. Being open with your doctor can help them better assist you, and they could possibly even prescribe you medications for anxiety, depression, and memory decline. You can also reach out to your local pharmacist. We know so many things about medications and their side effects, and we can also guide you to resources that can help you with your mental health. You can also contact your local National Alliance on Mental Illness organization. I provided a link that you can type into your web browser. It'll allow you to create a free account and learn more about the organization. But NAMI offers support and education programs for families and individuals living with mental health conditions, where you can access videos and discussion boards to learn more about mental health. Another resource that you can use is the National Institute of Mental Health website. Here you can learn more about mental disorders, including some of the ones that we talked about in this video, and other mental disorders, including PTSD, eating disorders, and OCD as well, among others. So again, MHAC would like to thank you for your time for watching this video. I would like to reiterate that you can leave us a message, text, or even email us using the contact information in the beginning of this presentation, and we would be glad to help you further on anxiety, depression, memory decline, or insomnia, and we can provide you with a consultation where you can speak to a member one-on-one. Thank you for your time.